It's 11 a.m. here in Seoul. I'm Woo Soo-young at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak here in the country. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation available in English. We're looking at the briefing room where Yoon Tae-ho, Director General of Public Health Policy, will be sharing his latest figures and updates on the COVID-19 situation in Korea. We're going to cut over in a short while. We're cutting over right now. He's taken to the podium and it looks like he's just about to begin.
And we have Jo Jae-yeon. We also have today with us Park Jong-hyun, who is responsible for PR management of the KCDC, and we also have sign language translation available. We have our briefing will be given by Mr. Yoon Tae-ho, and it will be followed by a Q&A session. I am the Chief of Quarantine Supervision Department, and let us now begin our regular briefing for March 18th, Wednesday. As of today midnight, a total of 6,789 are in quarantine, and we have 1,540 who have been discharged following full recovery, and the fatality stands at 84. Newly confirmed cases as of yesterday stands at 93, totaling making the total to 8,413. And I send my condolences to those who have passed away. Today, Prime Minister Chung Se-kyun convened a KCDC meeting in the morning, and he touched upon issues including extending the closure of social public welfare facilities, as well as supporting for SMEs and the supply of face masks. He said due to the coronavirus outbreak, he urged that the companies need to monitor their situation of raw materials and parts. And when the outbreak in China was severe, many factories halted their production, and thus many Korean companies faced difficulties in securing core parts. Although we have seen a decrease in the number of increase of the confirmed cases, we are still seeing cluster infections centering around facilities, multi-use facilities like churches, and we are also seeing an increase of the influx of infected people from overseas like Europe. The coronavirus is very fast and contagious, and therefore we need to curb. We have limitations in curbing the virus 100% with identifying the patients at an early pace. And we believe that when the people are in cluster, and especially in indoors, in closed-door spaces with no ventilation, we believe that the virus can be very contagious. And especially for considering this, we also continuously advise the public to refrain from mass public gatherings. And we were able to overcome the increase of the confirmed cases in Daegu because all thanks to the support and dedication shown by the medical staff, but also the social distancing which was kept by the public. And we need to let the public always understand that complying with personal sanitary measures is very crucial. I understand that it's a very difficult situation. However, we need to participate in keeping the social distancing. In order to fully curb the outbreak, we believe that the following 2 to 3 weeks will be very crucial. Out of the schools, kindergartens, and nursery homes will have closed their doors for an additional 2 weeks in order for us to really protect our children and our teenagers and to curb the further outbreak into our society. And as released before yesterday, about 500 teenagers and children have been affected by the virus, which stands at about 6% of the total of the confirmed cases. Although there were no fatalities of this age group, we believe that we need to further postpone the new school year into early April so that we can fully curb the outbreak and the spread of the virus. And by opening the school, it higher the risk of infection, and it can be another channel of infection within the society. The Korea Epidemiological Association also believes that the schools could be a new epicenter for the spread of the virus if it opens its door right now. So therefore, our government decision was decided based upon this. And we also are witnessing a consistent increase in the inflow of foreign influx of the virus. And considering this, we have decided to postpone the new school year of all schools and kindergartens by additional of 2 weeks. During this period, we will have emergency care, and as for schools, we will also heighten and intensify the teleclasses so that they can utilize this through online. And as for the daycare centers, we also have extended the closure by additional 2 weeks as well in order to really curb the virus spread of the virus within the society. And together with this, the government will make quarantine measures so that we can stop the curb of the virus. And we will make sure that we are fully prepared to reopen the school, and we will monitor any areas that need to be monitored. And as for the social welfare facilities, we are trying to curb the further spread of the virus within the society, and therefore we are closing the welfare facilities until April 5th. About 93% of the welfare facilities have closed as of now. However, when for emergency purposes, we have opened some cases, some facilities, so that we have no loopholes in care for our society. And we also will extend our scope of subsidiaries for the vulnerable class, and we will also increase the temporary incentives for those who are in the vulnerable class by about. And yesterday we also passed the new subsidiary budget bill yesterday at the National Assembly, and under this we will be able to secure more budget for treatment, and we will make sure that this is implemented as soon as possible. About 300 trillion won has been appointed to secure the negative pressure rooms, and we also secured additional budgets to enhance our hospital beds as well as the medical facilities to fight against the coronavirus outbreak. We will also increase the budgets for the supplementary budgets for the incentives that are given to the elderly who have been going through financial difficulties, and we have appointed about 18.1 billion Korean won for this, and we will also have secured the losses to help the financial losses of the SMEs and other companies, and we will be supervising and monitoring this situation, and these incentives will be provided as soon as possible. And as for the hospitals which are going through difficulties in financial aspects, we will also receive the applications for such incentives, and also we have additional budgets secured for increasing of our screening facilities and other devices that will be used at these centers, and this will be implemented as of end of March. The government also acknowledges and sends great gratitude to the medical staff who are working on site to fight the coronavirus outbreak, and we will spare no efforts in providing our support for these hospitals. And we will also expand the level of incentives and help for the SMEs, as well as the small employed as well. We have expanded the scope by large, and in order to help them stabilize their financial aspects, we will expand their the support to 2 trillion Korean won and their incentives to about 3 trillion Korean won. And of this amount, about 1.9 trillion won has been separately dedicated to the Daegu region, so that and we also will make sure that this money is divided and delivered to the area as soon as possible. As well as for the self-employed businesses who have been hard hit by the coronavirus, as it was visited by the confirmed cases, we will help these business peoples to recover to their own states and original states. And we highlight this numerous times, but we are seeing a stagnant increase of the number of cases on day, but we are still witnessing increases of sporadic outbreaks as well as cluster outbreaks. And considering the increase of the influx of foreign influx, it is too early to let our guards down as of yet. And just like the public has showed great support and participation, we extend our deepest gratitude, and we need to highlight the fact that each of the public is very crucial in terms of complying with the personal sanitary measures. Washing of your hands thoroughly and keeping the coughing etiquette is very important. And please refrain from mass gatherings and outdoor activities, and please keep social distancing always. And because the new infectious disease like the coronavirus has no borders, it can spread anywhere and affect anyone. We need to effectively curb the virus by emphasizing the fact that we are a united solidarity, and we need to highlight cooperation as well as a sense of solidarity. We can fight over the coronavirus outbreak if we cooperate together and muster our strength and wisdom. Thank you very much.
That was a live briefing from the South Korean government, filling us in on what the situation is with the coronavirus situation here in Korea. That was Director General Yoon Tae-ho, and we just heard from him that there have been 93 new cases of the COVID-19, bringing the nationwide total of confirmed cases to 8,413. Also, 3 more people have died, bringing the total death toll to 84. Well, that concludes our coverage of this morning's briefing. We'll be back in just a short while at 12 p.m. Korea time with our midday news. Bye for now.
For the